For this particular research study, senior leadership at one of our hospital clients was concerned that one of their healthcare systems' outpatient centers was losing market share to nearby competitors. So some quick facts surrounding this business objective in question. Leadership believed that the healthcare system had high brand loyalty. They did, however, know that new competition recently entered the marketplace. And over a short period of time, there was a drop in market share. It was only really a short period of time that they noticed a pretty significant drop in market share. So they came to us, and what we did was we put together a market research strategy. So the question was, basically the bottom line question is, where are we losing market share, and where are there opportunities to recapture share? Now, they did add some hard number evidence to tell them where they were losing share, but they wanted to get more than that. They wanted to reach out to the community and discover really what was going on and why it was happening. So we conducted a CMA, a consumer market assessment, to gain competitive intelligence as well as pinpoint market gaps. And this research project went very, very well. So what happened? Our results confirmed that women's services were critical in the community. And it also, we were able to identify an opportunity to capture market share by investing in expanding and promoting their women services and their programs. Very important. So all along, they have these wonderful women's services, but they weren't properly promoting them, or they weren't putting enough energy into promoting something that was really needed in the community. So now I'm going to turn it over to Mike to tell us how the implementation plan happened and how it worked.
Thanks, Joe. This project was kind of neat and exciting because it really, from a business intelligence perspective, it really put all the pieces of the puzzle together. We had market share data from a third-party source. We had physician leakage perspective from a third-party source. So we kind of knew what was happening in the physician marketplace, where they were referring. And this was a women's services program. So where were they referring? Simply mammographies. Where were the mammographies going from primary care and OBG perspective? What's our market share, as Joe said? Well, the market share going up or down in those areas from an outpatient diagnostic services perspective. So we had the data, but let's overlay the real important data in this. Let's talk to some women. Let's find out who they think of in terms of health systems or hospitals when they need women's services, and let's say mammographies. What doctors are using us or not using us? What types of services are they looking for? What this study was able to do finally as well is it provided baselines. Like, we knew from a, let's say, an awareness or a preference perspective from this study, what women thought about our hospital or our system from a global women's services perspective, and what they thought about the competition. So once we did this, we were able to do subsequent surveys down the road. You know, we always talk from a marketing perspective, what's ROI, how are we going to demonstrate it? This is a good way to demonstrate it, because you have a baseline study that says, here's where we are against our competition from a female or consumer perspective, and here's where we've gone after the marketing campaign. The marketing campaign and messaging was driven by this study. What we found when we spoke to the women through Joe's study is they were looking for access, they were looking for convenience, they were looking for same-day appointments, and we had a program in place. It was called the Triple Read, which is kind of a rule of thumb. It's a popular program, obviously, in women's centers across the country. Triple means, obviously, 3 diagnostic professionals are going to read a mammogram. We had all board-certified imagers doing that. So we had a great quality technology leverage point that we could take advantage of from this research that women felt were important, but they didn't know we offered it, and the competition didn't offer it. So we had a competitive advantage, and we had a great messaging topic because we knew what women were looking for. Launched the campaign. It was a combination of PRM going directly to our physicians and engaging the physicians in the marketplace through our liaison program, that they became aware of our programs, aware of some of the high quality services, that we had same-day appointments available, access was there, who the team was. So we were able to turn that physician leakage around and begin to reduce it and get more volume in terms of some of these diagnostic services coming into our outpatient center. There was a CRM component of it as well, mostly on the digital side. We did a lot of SEO. We built a great landing page. We had a lot of SEO and SEM, strategies in place. Some results on that were remarkable. When we launched the program with the right messaging in our search ads, with the right content on both our landing page and our website, we came out of the box experiencing 500 to 600 page views a month in terms of this service. We were capturing coming out of the box 100, 150 to 200 requests for mammograms on a monthly basis. So we were able to go directly to women through some of the traditional digital CRM and marketing tactics and get them to engage with us. But as important, we overlaid the physician side in this from a PRM perspective and said, we need to know why you may not be referring. Did you know this? And we really leveraged our liaison teams to get that message out and to turn things around. As Joe said, wrapping up with my point on this study, is we already had a good, strong brand name in that marketplace. So it wasn't, again, that we had to build a brand name. People knew of the hospital and health system. It was more, how do we directly address some of the needs they have as it relates to women's services vis-a-vis our competition, and measure it with both the intelligence we had as well as this consumer study that we could benchmark and compare against. Real good case study, real good research project that helped us, again, grow market share, get a solid ROI from a digital perspective, increase physician satisfaction with our services, and improve some quality and access items. Thanks, Joe.